Dr. Vranick. Welcome to Western Vascular Institute. This is our office cath lab. We will be performing a procedure on a 73-year-old patient who has disabling claudication to the right leg. Her ankle brachial index, which measures the amount of blood flow going down her right leg, is quite diminished. It measures 0.24 with exercise indicating severe blockage down the right leg. So what we're going to do right now is we've gotten access into the left femoral artery with a sheath. We're going to be working through that sheath. We're going to go up down to the abdominal aorta and start taking some pictures and see where these blockages are and treat them accordingly. Alright, quite a bit of disease there. You see the femoral artery is nearly occluded there. And the profunda artery, which should come off the side, is barely open, filling very late. This is an angiogram of her right knee area. You see the femoral artery from the knee all the way up is severely diseased, and it is occluded or 100% blocked right above the bone, right by the knee, just above the knee. And now what we're doing is an angioplasty of the femoral artery with the balloon, and you see it opening up that blockage just above the bone there. And we're going to keep that for about 3 minutes. Now what we've done just before the balloon angioplasty of the femoral arteries is we passed an atherectomy catheter, which essentially is a little blade in here that travels over a wire into the artery, and it basically creates a tunnel by carving out the plaque and collecting it inside the catheter, opening up a channel so that there's better blood flow in that artery. So right now we're doing a balloon angioplasty just to open up the canal that we've created with this atherectomy catheter. And this is called a Silverhawk by the EV3 company, and that's a catheter we routinely use and does a good job opening up a lot of calcified vessels. Right now we're ballooning the common femoral artery with a 5mm balloon to crack that plaque, and it looks like it's opened up quite nice. So we'll leave that up for 3 minutes. We're doing another pass with the atherectomy catheter. I like to shade it in different quadrants of the artery to debulk that artery, which is loaded with plaque. And on a side note, what we are doing here is basically an office treatment of peripheral vascular disease, and we're quite proud of our achievement here at Western Vascular Institute. We have one of a few centers in the whole state of Arizona that's doing this. This is part of the government's cost containment to try to control the cost of health care, and essentially it is a cheaper procedure. Passing this atherectomy catheter through the blocked arteries, and there's a blade right where the laser pointer is on that's cutting that plaque and creating a tunnel through the femoral artery. And then after this, what we'll do is use a balloon angioplasty to tailor that plaque and to widen up the vessel. Sometimes we need to use stents if the blood flow is not acceptable, but normally we do not have to use stents. We typically do about 3 to 4 passes through the artery, shaving that plaque. And the patients really love it because their length of stay is basically cut in half to essentially a few hours here in the office. This lady will recover for about an hour and then go home, which is a big change compared to hospitalization, where they often are in the hospital for about 8 hours prior to being discharged. So This is the atherectomy catheter that was passed through the patient's right femoral artery, making a tunnel or debulking the plaque and blockage in that artery. And now what we're going to do is clean it out and see if we've accumulated any plaque in here, which is the goal. And there you see that brown tannish plaque. That's all atherosclerosis, hardening of the arteries, peripheral vascular disease that's accumulated. And we will do a number of more passes to try and get as much of that out as possible. We've done a number of passes with our atherectomy catheter through the femoral artery, and now we're just going up with the balloon angioplasty. You see a little bit of air in the balloon, which is normal. And we're opening up that artery, and you see there's really no residual plaque. At this point, we're just using the balloon angioplasty to tailor that artery to the dimensions of the balloon, which is about 5 millimeters wide, to create a nice channel so that there's no residual plaque obstructing the lumen. And the patient is currently sedated. How are you feeling, ma'am?